Welcome to Break Everything. Your host, Lisa L. Levy, will guide you through critical thought conversations and a journey of directed disruption that makes a difference. Experience bold conversations with industry leaders who are willing to challenge the status quo.
Hello and welcome to another episode of Break Everything. Today I'm very honored to have Thomas Dahlborg with me. The show you will be watching right now is on YouTube, LinkedIn, Apple Podcasts, Google Podcasts, Stitcher, Spotify, and so many more. But we today are talking about something that is a refreshing idea: health caring. We're going to dig into that a little bit more with Tom, but I want to let you know who he is. So Thomas H. Dahlborg is an industry voice for relationship-centered and compassionate care and servant and relationship-centered leadership. He holds a master's degree in health services management from Lesley University. Tom has more than 28 years of extensive leadership experience building relationship-centered, patient and family-focused, empathetic, compassionate care models. He is skilled at analyzing and meeting patient and family expectations, optimizing strategic partnerships, ventures, and teams. He is an innovative leader, and he is skilled at bending the cost curve. He's an author, a consultant, advisor, and a nationally recognized speaker. Tom is passionate about changing the healthcare system to a health caring system. I think it's obvious to everybody in the audience why Tom is here with us today. I am so grateful that you're spending some time with us. Thanks for joining.
Oh, I'm thrilled to be here, Lisa. I've been looking forward to it.
Fantastic. So Tom, I did the standard kind of intro stuff, but it's so much more interesting if you will tell us a little bit about your story and how you found your way into healthcare.
Sure. I've been in healthcare for about 40 years. I started off as an IV aide and a transport aide and a housekeeper for a small community hospital just south of Boston, and got to see healthcare from literally the ground level, and got to see how important it was for us to connect as human beings, to have relationship at every level within the healthcare system. And I remember a story as an example when I was in transport, and I got to know this elderly woman who had been in the hospital for quite some time, and I was wheeling her down for some treatment, and for cancer treatment. And she said to me when we got there, she said, "Tommy, can you stay with me? My family's not here, and I'm scared." And Lisa, it just really struck me at how important each one of us is in the entire continuum of care, and how important that humanity is in that continuum. And from that point on, I knew I wanted to be more and more involved in healthcare. I remember as an undergraduate meeting these amazing mentors, and I was in pre-med at the time, and I realized, I wanted to be on the other side of it. I wanted to help in a different way, to where my skill set was, and these people taught me and showed me and role models for me how we can lead and change and make a difference, even if we're not the clinician themselves. And that, again, continued to drive it. So I've worked in the for-profit side of healthcare, the nonprofit. I've been a CFO. I've led parent partner programs. I have a quality improvement background. But, at the end of the day, and I'm married to this brilliant nurse, and my bride is just incredible and continuously informs me, and I get to work with amazing people. So we have a lot of work to do. There's also incredible flames of good in healthcare, and I want to help fan those flames, and I want to make a difference on the other side.
Absolutely fantastic. And you have played in so many different roles and done in different perspectives within the industry. What's the best part about what you're doing now?
I would say it's being able to leverage all of that, all those experiences, all those relationships I have, and then through different lenses, find solutions. Either, again, solutions to recognize and fan a flame of good, or a solution to say, we might want to do this different. Let's bring these other people to the table. Let's get their perspectives as well. And together, let's make a difference here. And it's just so incredibly rewarding to do so.
It's fantastic. I understand that you have a unique perspective related to, patient-centered care. You started out with, a story of that, that critical moment that changed, the perspective that you had on where you wanted to play in the field. But let's talk a little bit about your perspective on patient-centered care.
I'm thrilled to. I've always been once I had that encounter and I got to learn from them, I'm like, oh yeah, it's all about patient-centered care. But again, I've seen other lenses, I've seen other perspectives, and what I've learned is if we think about a pendulum, we used to be all about provider-centric care or provider-centered care, and now that pendulum has swung to patient-centered care. But what's happening as that pendulum is swinging? One physician per day is committing suicide. Nurses are leaving the field for lots, and again, these are for lots of different reasons. But one of the key pieces of it is we've put so much focus on one side versus the other that we've lost touch with both. And we need both and. We really need to think about all those relationships in that entire paradigm. And we need to recognize, we need to embrace, we need to love, and we need to care about everyone there. Because if it's too much on one side versus the other, we're harming somebody. When we actually focus more so on relationships than the care, all those relationships, we're bringing humanity and compassion and love throughout all of it. And we're positioning everyone to be whole and as healthy as they can be, depending on what journey they're going on, but helping them on that journey. And so patient-centered care is a wonderful concept. It's better than where we were. It's far better than revenue-centered care, and we can still do better.
Well, in that, there are a couple of things that are interesting that you're talking about. You use the phrase, it's a journey, right? And so it is, there's a continuum, right? The patient is in a journey, and more often than not, it's not a favorable journey, right? Most of the time, right, when we're ill and in need of healthcare, there's pain, there's uncertainty, there's discomfort, there's fear. But to deal with all of that, we have everybody around us who's on that journey with us, from the nurses and the physicians, certainly, but the people who are managing the hospitality of making sure that there are bed linens and that there's food delivered. There are a lot of players. And until this conversation, right, I know that I personally have been very vocal about wanting patient centricity because they're the ones that are in jeopardy in some way, shape, or form. But it's the continuum. It's everybody who's a part of the journey. It matters a lot. And it's not one over the other. And that's a powerful revelation, because if we are focused on one end of that spectrum or the other, we're missing the majority of the needs.
Exactly. And as I mentioned at the beginning, I was a housekeeper. And again, I was blessed to have opportunities to have relationships with patients and families. And a good friend of mine, who I got to work with at the National Institute for Children's Health Quality, she told me a story about a housekeeper that she had a relationship with. And it was her daughter has sickle cell disease. It was Easter weekend. And my friend, the mother, was in the hospital with her daughter over Easter weekend. They're a very spiritual family. They wanted to be home. They wanted to be at church together on Easter. And this housekeeper came in, and he knocked on the door, and he was invited in, and they got to know each other over the past week or so. And she told me the story about how he came over to her, and he saw that she was crying, and how he said, "Excuse me," and he left. And then a little while later, he came back, and he came back with a bouquet of flowers, and he came back with a stuffed bunny, and he gently put his hand on his shoulder, on my friend's shoulder, Lenny, and he said, "I just want you to know I'm here for you." And we all are. And Lenny, to this day, that was probably 20 years ago. That's what she remembers about the care at Brigham and Women's Hospital in Boston, was that housekeeper that cared so much to meet her where she needed to be met at that particular time. That's relationship-centered care.
And that's going to be a phrase that I take away from this, is that it is relationship-centered care. And I think that that's so much more powerful. As you're telling that story, I was remembering sitting in a hospital with my grandfather as he was not quite dying, but it was coming. And it was a teaching hospital, and right, lots of doctors, lots of doclings, as I like to call them, running amok. But the housekeeping, and that story triggered this one woman who came. I went out in the hallway because they'd been through and they left the mess. Right, there's just stuff everywhere, and I was so devastated. I went out in the hallway to find somebody. I said, "I can't believe that we leave patients in this situation." And she, took me by the hand and she said, "We'll fix it, honey. It's fine." And she came in and she cleaned up the room and, made everything more comfortable for him. But, for me, I was there 12 hours a day, and it was like this tornado had run through with the process of doctors learning. But then what? And so, yeah, that continuum, that relationship is so impactful. I hadn't thought about that story in probably 8 years. So what you're talking about resonates. I mean, that came full out of thin air for me just now. Thank you for talking a little bit about that. With this idea, you started writing books. The first book that you wrote, From Heart to Head and Back Again. All right, that's an engaging title. Take me through it.
Well, it was 2001. I've been in healthcare for about, 15, maybe a little bit more than that, years at that time. And I got sick. And I was working in military healthcare at the time. And I had flown across country. And long story short, I finally made it home and ended up in the hospital. And I was told I'd never work again. And I was told eventually to get in line for a heart transplant. And I was told to go to the pain clinic to manage my pain. And I had this wonderful physician have basically a clipboard of, and he said to me, he said, "Tom, where do you want to start?" I said, "What are we talking about?" And he says, "This is your menu." It was a menu of narcotics. He wanted to know where I wanted to start. And we wonder why we have an opioid epidemic today, or one of the drivers of that. And long story short, I got better over time, and more folks had told me that I need to write a story, both from the perspective of a healthcare leader and also the perspective of a patient. And that's what that book was all about. And a key point of it, and hence the title, is how important the both and is. We need the evidence. We need the research. We need the clinical skill. We need all of that. We need the tech and the pharmaceuticals. We also need, so that's the mind, we also need the heart. And it wasn't until I met a physician on my own healing journey who sat with me and sat with my bride and put his hand on our shoulder when we needed a hand on the shoulder, who listened to us, who spoke to us about our fears and about our anxieties and about the all the different challenges before you, because it's the health challenge, but also I had young children. My bride was home with she's a nurse, of course, but my bride was home with our kids at that time. So if I'm not working, now we have some other challenges, and we talked about all those things. He wasn't behind the desk. He wasn't looking into his computer and typing in the whole time. He was around his desk. He was sitting with us. And again, relationship. We were connecting at a heart level. And so I wrote the story about it. And I wrote it so that others could also reflect on their own healing journey, or someone else maybe they love in their healing journey. And it's actually now being used as part of AFA to assist healthcare leaders of tomorrow to learn about other perspectives. Again, you need both and, the heart and the mind.
That's fantastic. And it is an important set of skills and capabilities that aren't taught in med school, right? To actually build a rapport and relationship. I mean, doctors go through their internship and their residency and that level of interaction, but it's sort of a trial and error. And I do think that, bedside manner, it's a set of skills, and people can learn how to manage the relationship. And that's an interesting twist on needing to have how we build that trust, because that's the difference.
Absolutely. And a key aspect of trust, and when we look at the science around love quotient and so forth, a key aspect, a lot of people don't want to talk about love. I'm like, we need love in healthcare, and when we think about, like I said, the love quotient, an organization has a high love quotient. You have the emotional intelligence, you have the clinical intelligence, you have all of it. When you have the love intelligence or love quotient as well, to get to trust, when you have love, you have that caring, When the challenges arise, you're in it together. You're going to make a difference. When those challenges arise, you can lean in on your love and on your trust, and you're more willing to see it through and to make things better. When my child is sick, and I love my child, I'm going to ensure that we're going to do everything it takes. We need that in healthcare for all patients and for all of our colleagues throughout the system. And when we do that, then we've really turned the dial and made a difference.
Absolutely. So another aspect of your passion stems from work with kids. And with that came your second book, The Big Kid in Basketball and the Lessons He Taught His Father and His Coach.
That's exactly right. So my son was born with neurological challenges, and he was a big child. And when he was 4 years old, it was the first time we really saw that he was being bullied. And he was being bullied predominantly by adults. And my bride and I were just blown away. It's like we thought we were the worst parents ever. And luckily, I was working for the National Institute for Children's Health Quality, and I had access to a team, experts. And what I learned was it wasn't an aberration. The number of children that are being bullied by coaches, teachers, other parents, and more is just through the roof. And the studies are incredibly sad. And so I wrote that book because we, as a family, and my son and I went on a journey. We utilized basketball as a tool for my son to begin to love himself, to love his body. And so I published that one a number of years ago, and Lisa, I was blessed. It got picked up, and I got to speak, and I got to work with other programs, sports programs, and educational systems. After that, or during that, my son, who again started being bullied when he was 4, when he was 23, he came out on the deck one morning. My bride and I were outside drinking a cup of coffee, and he said, "Mom, Dad, I need to tell you something." And we said, "What?" And he said, "When I was in 4th grade, I put a belt around my neck." We had no idea at all. And so here I am years later, I'm talking about bullying and what we all can do, not realizing a huge miss that I had.
Yeah.
And so it's further informed us on how important this work is, to share the lessons we learned, the mistakes we made, and then the best practices that we've learned from other experts, and to try to make a difference. And so the book you reference is actually a second edition, because I was able to learn from that horrific, thank God didn't happen, experience, and utilize that additional passion and love and wisdom that I learned from others, and to share that to try to help others. And so my son and I now co-present, and we share his story and our journey. And we're actually rolling out our first youth sports camp this month, which really focuses on, yes, on the court, but so much more off the court, and how to help these kids and help parents and help programs do better. Because we have an opportunity to really, really, really help children. And especially during these trying times, they need us more than ever.
They do. And Tom, thank you for sharing that very heartfelt story. And please take a moment that it's impactful, right? The topic that we're talking about is healthcare and what's wrong in the opportunities. Let's not focus on, right, the opportunities to be better. And mental health is a huge area that we need focus on, which wasn't necessarily where we were going with our conversation today. But the story and the work that you've been doing is huge. And you as a parent had the support of a large institution behind you with access to knowledge and information that the average parent would never have. So the book, the speaking, and what you're doing with that, I am certain is making a difference. And thank you and Tommy for being willing to do that for others.
I appreciate that. And yeah, I appreciate that. It means a lot.
Absolutely. And through all of this, we've teased, right, the idea of your language of the term health caring. But I think now's a really good time to dig into what that really means and what you're doing with that and where that's taking, where you want that to go.
And I love that we're going to focus here. Again, I've witnessed firsthand how important relationship is, how important caring and love is. My son, that we just talked about, he's very much involved with a psychiatrist and counselor still to this day, and how important those relationships are. I've worked for organizations that have tried to improve patient experience and quality and patient safety. And it was all about tactics, all about we need to do tactics. And the connection between us experts and the folks on the front lines, who, by the way, are the real experts, was all science-driven, tactical-driven. Mm-hmm. And so what it became, though, was all about checking the box. Did I have a conversation? Did I send a thank you note? Did I do this? Did I do that? It was all checking the box. It wasn't about the caring and the loving. And that's when I realized, again, as we talked about at the beginning, I've been blessed to be informed by lots of different experiences from lots of different ways and with lots of different people. I said, we got to move past that. We need to move past tactic to relationship. We need to move past that. We need to really think about how we can bring love into the equation. In fact, again, just last week, I was asked to come and present in Tennessee on leading with love because of how important it is. And it's again, most people think of it as squishy or romantic, and it can be, and it should be in certain areas. Here, the science shows it improves outcomes. When you think about Compassionomics, that book by Steve, I always say his name wrong, Cherzak, Compassionomics. The science shows compassion heals. There's Helen Rice's work out of Harvard. Science shows that empathy heals. But where do we spend our time? We spend it on tech and pharma and tactics. All incredibly important, but it has to be the both and. The healthcare to healthcaring is when we add back in humanity, when we add back in compassion and love and caring, and we make those connections. In fact, I would even argue that we need, not argue, but I would put on the table, I'd recommend that when we think about our selection criteria for the CEO and for the housekeepers and for the nurses and everyone in healthcare, we should be adding to the mix the love quotient, the ability for each of us to love oneself and to love another. When we do that, if we start to develop health systems that are actually incorporating the science around compassion, humanity, empathy, and the love quotient science, then we've really created something special. Then all the challenges that will come before us, together with trust and love in our hearts, will be able to make a difference. And so I get the opportunity now through Dahlborg HealthCARING Leadership Group to work with nurses, to work with health systems, and to bring those messages and to bring processes to help people reconnect with themselves and reconnect with others.
Absolutely. There are several points in there that just are so impactful, but wanting to pull on the thread of taking care of self first so that you then take care of others. So when we're talking about our nurses and our physicians, being able to focus here so that they can do their job and do it well and take care of patients. I mean, it is a huge part of it. The phrase empathy started coming back into the hospital kind of lexicon 7-8 years ago, right? And it's important, but you used all sorts of different words. It's love, it's empathy, it's compassion. There are all of these things that, and I will own, I was working at consulting with a hospital group 8 years ago, and they started talking about empathy, and I started giggling. I just didn't quite get it. And I'm so embarrassed to say that today because, everything that you just described is what makes the actual difference that will change what's wrong with today to make it better tomorrow. And, how obtuse I was at the beginning because it felt warm and fuzzy, and it wasn't a checklist with a checklist and a checklist so that we knew what we were doing, how we were doing it, and that we could prove that we had done it well. Sorry, I'm kind of process driven, but that's only a small sliver of the whole puzzle.
Exactly. And when we think about, a lot of us are talking about social determinants of health, the social influences of health, and we think about what contributes to the well-being of somebody. And we think about, the socioeconomic conditions. We think about personal behaviors and all of that. and again, I'm a reformed CFO, so I'm very analytical. And so I was going through all these data and all the research and all connections and stuff. And I realized that when we really put it all together, the science of medicine, the clinical aspect of medicine is a sliver of the full, to your point, to the full picture of well-being. What is even greater than that science, which is incredibly important sliver, is compassion and love. Yeah. And that's almost the equivalent of the social and economic condition and those other pieces. So I hear you, and I understand, and I appreciate you saying what you just did. And we need to get to that place of understanding again. When we take heart and mind, science and love, and we put them together, that's when the magic happens. And I'd love to, you brought up another incredibly important point that I'd love to hit on, which is that you need to love self and really care for self. And I agree 1,000%. What I've also seen, however, the flip side of it is in healthcare, when we think about burnout, nurses burnout, doctors burnout, oftentimes what do we say is, you need to take care of yourself better. Now we just blame the person. What we need to do as healthcare leaders is think about Deming and the 94-6 rule, which is that if there's an aberration, if there's an issue, 94% of the time it's system related. 6% of the time it's person or individual related. When we think about as leaders, we need to look in the mirror and we need to make sure we're positioning our nurses and doctors and housekeepers and everybody to be able to care for themselves, to be able to honor their calling, and to love on and help and use their minds and their hearts to make things better. And so, again, it's that both and.
Oh, it absolutely is. And as leaders, it's about positioning them to be able to, and providing them mechanisms, tools and techniques and things to make it actually possible. And there are people out there who are doing some fabulous work in that space. Tom, this conversation is so much fun. I could keep us going all day. But I'm not really allowed to do that. So I would like to come to my favorite question. And with everything that we've talked about, I am so curious what you're going to pick as your magic wand moment. So if I gave you a magic wand that removed all constraints, what would you do to make health caring real?
We talk a lot about value-based care, value-driven care, value-based reimbursement. We love to use those terms. If I have my magic wand, that goes away because the research shows, and you go to Harvard and say financial incentives in healthcare do not work. But rather, I would say values-based care, values-driven care. I would transform the institution to focus on our values as humans, our values as with compassion, all those things we already talked about. That's what I would do. I would use that wand to ensure that we're all loving on ourselves so that we can love on others. And we're creating the systems, to your point, that allows us all to do so.
Isn't it fascinating what happens when you change a word just a little bit, right? From value to values, and the impact that would actually make is mind-boggling. One of my most favorite parts about the magic wand question is the answers have all come in very simply. What you just described is not, rocket science, and it is not necessarily difficult to make happen. It's complex in the mechanics of overcoming what currently exists. And I'm not quite sure what to do with that theme. I wasn't, as I started this series, I didn't know where we were going to go with the magic wand moments. But the ideas are all actually very attainable if people are willing to change.
Exactly. What's sexy out there? Technology's sexy, and it should be. It can do amazing things. And that new AI, which was in the technology space, that new surgical procedure, those are all sexy and they're incredibly important. Relationship and love and compassion, it's not necessarily sexy when we put it in the context of healthcare. However, it's the foundation. And we add hope to that. That's where we can really, again, use your magic wand and work magic together.
Absolutely. Tom, I think that that's going to wrap up our show for today. I am so happy to have spent some time with you. Thank you for being here, sharing your thoughts, your perspective, and I am absolutely using the phrase health caring often as I go forward in these conversations. For those of you watching and listening, thank you for your time and joining us. You can watch us again on YouTube, LinkedIn, Apple Podcasts, and all of those other great places. Until next time.
Thank you. Thank you, Lisa.
You have just experienced Break Everything with Lisa L. Levy. Critical conversations on directed disruption that makes a difference.